Hello and welcome. Today we're going to talk about something that affects our absolute tiniest patients, retinopathy of prematurity. Now, for parents, for families, this can be a really scary diagnosis. So our goal here is to just walk through what it is, why it happens, and how it's managed, using the expert guidance from the Will's Eye Manual to break it all down.
So let's start with the most basic question. You might be thinking, with everything else a preemie is going through, why on earth is a special eye exam so incredibly important in those first few weeks? Well, the answer is all about how the eye develops. It's a really delicate process that gets cut short when a baby arrives early.
So what exactly is retinopathy of prematurity, or ROP, as you'll hear it called? At its heart, it's a condition where the blood vessels in the retina, that's the super important light-sensitive layer at the very back of the eye, don't develop the way they're supposed to. And this is something that happens specifically to babies who are born before their eyes have had the chance to fully mature.
To really get a handle on ROP, we first have to look at what a premature birth actually does to that fragile process of eye development. It's really a story of a journey that's been interrupted, and how the body sometimes tries to finish the job in a way that can cause problems.
Here's a really helpful way to picture it. Just imagine the blood vessels in the retina are like a big, sprawling road network. Construction on this network starts way in the back, at the optic nerve, and it just grows and grows towards the outer edges. The whole project is timed perfectly to be finished right around a baby's due date. So, in a full-term baby, that road network is totally paved, complete, beautiful. But for a preemie, it's like the construction crew suddenly walks off the job. And this leaves big parts of the retina without the blood supply they desperately need. The body, trying to fix this, starts building new roads, but these new vessels are fragile and abnormal. And that abnormal growth, that's ROP.
And this right here is why that first eye exam is so incredibly critical. It's not about waiting for a problem to show up. It's about being proactive and looking for the very earliest signs. This lets doctors step in before vision is ever at risk, and it can prevent what might otherwise become permanent vision loss. Okay, so who actually needs to be screened? The medical guidelines are really specific here. We're talking about the tiniest babies, those with a birth weight under 1,500 grams, or about 3.3 pounds. Also, babies born before 30 weeks, and sometimes slightly bigger babies who've just had a really rocky start might need screening too.
And you know, timing is everything. The first exam isn't done right away. There's this very specific window, usually around 4 weeks after birth. It's all about catching ROP right as it might be starting to develop. Not too early, and definitely not too late. It's a real sweet spot.
So the bottom line is this. The whole point of this carefully timed screening process is to find any hint of ROP as early as possible. That gives the eye specialist the absolute best shot at protecting that baby's precious sight for their entire life. It's truly a race against the clock.
All right, so the exam happens. What are doctors actually looking for? Well, if they see signs of ROP, they classify it using a very specific system. Let's break down the lingo they use so it makes sense. We're talking about zones, stages, and something called plus disease.
So this whole system has 3 key parts. First, zone. That just tells us where in the retina the ROP is happening. Zone 1 is right in the center, and that's the most serious location. Next is stage. This describes the severity on a scale from 1 to 5. And finally, you have plus disease. This is the big one. It's a major red flag that the condition is active and getting worse, fast.
To make that a little clearer, let's just compare 2 of the stages. In stage 1, you see a thin little line that separates the part of the retina with blood vessels from the part without. But by stage 3, whoa, that line has grown into a raised ridge of tissue, and those fragile abnormal blood vessels are starting to grow out of it. It's a big difference.
And now we have to talk about plus disease, because it is a total game changer. This isn't a separate stage, it's something that can show up with any stage. It means the normal blood vessels in the back of the eye are getting all swollen and twisted. It's basically the eye's way of screaming for help, signaling that the ROP is getting aggressive and needs attention right away. And that, of course, brings us to the next big step. This whole classification system isn't just for labeling things, it's what tells doctors exactly when it's time to step in and start treatment. This quote from the medical manual says it all. While the zone and the stage are really important, it's often the appearance of plus disease that is the #1 sign telling doctors, okay, it's go time. It's the main trigger for treatment.
The goals of treatment are super clear. Number 1, stop those bad abnormal vessels from growing anymore. Number 2, and this is huge, prevent the retina from detaching, which is what causes blindness from ROP.
And number 3, give the normal, healthy vessels a chance to get back to work and finish growing the way they were supposed to.
So whether a baby needs treatment or is just being watched closely, the journey doesn't end after one exam. Not even close. Consistent, regular follow-up care is absolutely essential for a good outcome.
And this follow-up schedule isn't a one-size-fits-all thing. It's completely tailored to each baby's needs. The most serious cases, like those in Zone I, get checked every single week. Moderate cases might be every 1 to 2 weeks, and the milder cases that seem stable can go a bit longer between exams.
So when can everyone finally breathe that huge sigh of relief? Well, the exams can stop when one of 3 things happens. Either the retina's blood vessels finally finish growing all the way to the edge, the baby hits 45 weeks of postmenstrual age without any major concerns, or any ROP they had has completely gone away and stayed away.
And this really brings it all home. The story of ROP is just an incredible testament to what modern medicine can do. Through careful screening, really understanding this disease, and acting at just the right time, we are completely changing the future for these kids. It leaves you with this powerful question: how much more can we do to protect the vision of these unbelievably resilient little patients?